An administrator shapes organizational culture by starting with their leadership style. The principles by which an administrator will guide an organization are heavily influenced by their work ethic, their interpersonal skills, their emotional intelligence, and their experience as well. This will affect recruitment processes, it will affect the team building approaches, it will affect the decision making processes, it will affect also the enforcement of the policies and the procedures that are going to be established. Why will these affect coordination and why will it affect performance as well? Because it's shaping internally the structures that allow the information sharing processes, and it affects the structure for feedback as well as affecting the workflow of daily activities between different departments. A barrier that is mentioned by How Little 2022 are the incompatible values that stem from cultural differences and might disrupt the alignment across different functional units. When a workforce is diverse, we may risk to have personal issues stemming from cultural differences in areas such basics like respect and communication. Well, due to this may be an interruption in the information sharing processes that might lead to delayed treatment, delayed imaging, delayed laboratory results, delayed diagnosis, and as a consequence, a delayed service for the patient, which can lead to adverse health outcomes as well. An administrator must delegate to the unit directors all the tasks that are related to the vigilance and to the monitoring of their staff behavior, and they need to implement disciplinary or rewarding measures as accordingly. Additionally, they need to delegate to the Human Resources Department all the activities that are related to team building, and they need to provide the resources enough for them to host events where there's going to be recognition for those staff members who have achieved desirable conduct as well. Additionally, they need to implement the surveys that are going to be for self-reflection among the staff and to promote the accountability, and they need to make sure that the feedback structures between the supervisors and their staff are being set in place accordingly, and there are no communication issues to ensure that the personnel is being guided accordingly to ensure and maximize their performance as well, and ensure and reinforce a good conduct among them. A leadership strategy that is mentioned by Howell et al. 2022 in his chapter 12 is the modeling, teaching, and coaching approach. Well, this approach will allow for all the daily activities to be carried out in alignment with the values and the principles that are established by the organization through their exemplification in their role model, which is the leader. So the leader will help the rest of the employees to stay committed with the mission and the vision of the organization through small activities such as exhibiting punctuality, exhibiting respect, exhibiting assertive communication, and to be respectful to the patients while providing an exceptional care as well. This will allow not only to create a healthy organizational culture, but will also allow them to stay engaged, to stay committed, and to stay motivated as well. With this in mind, we can conclude that all the issues that stem from the incompatible issues due to cultural differences can also be addressed through this approach, and through assertive communication, through tolerance, and through mutual respect among all the different employees across different functional units as well, enhancing the collaboration processes, enhancing the workflow processes, not only improving the quality of care that patients are receiving, but also improving the organizational culture in which the staff members are working in as well, thereby also boosting the performance.